Hello. So you'll notice this is a different video. I'm not green screened into a PowerPoint with big words behind me. I wanted to talk about the systemic reasons for burnout and how they've gotten worse under the last year, because it seems like our current government is dead set on making that significantly worse. So let's just get started into it. Yesterday, they discontinued the Affordable Care Act subsidies. Now, if you don't know what that means, don't worry, I'm here to talk to you about them. Okay, so before I really get started into everything that's been going on recently, we need to talk about how health insurance works in the United States of America. So you have either health insurance through your employer, you go through the marketplace like the Affordable Care Act, you have Medicaid, or you have Medicare. We'll get into those two later. So for most people, myself included, I have health insurance provided through my employer. So how does health insurance work for people that don't have health insurance through their employer? Well, even people that have health insurance through their employer, it just kind of depends on where you work and whether you work for a good company or not. I actually do work for a good company. I enjoy the company that I work for. I don't have anything bad to say about them. This is more talking about everything else going on in the United States. So for people, they have premiums to pay. Now, a premium is a monthly subscription to have health insurance. So for some people, it's like $200, 300. It can be like insane, like up to 2,000. It just kind of depends. But what is a premium? A premium is a monthly subscription to your health insurance. Now, you don't actually get anything out of your health insurance until you meet what's called your deductible. Now, what is the deductible? Well, say that you go to the emergency room and it costs $1,000, but you have a $2,000 deductible. You have to pay $1,000 because you haven't met that $2,000 deductible in order for your health insurance to actually kick in. That's insane, but that's just how it works. So for like me, I have a $1,700 deductible, which is not bad, honestly. And the last time I went to the doctor as a healthy dude in my 20s, I paid $700 for just a annual visit and a set of labs. That is expensive, but I have good insurance. I have a good paying job. I am very thankful. There's a lot of people that are not as lucky as me. So for me, I had to pay that $700 and I still haven't met my deductible this year because I really don't have a lot of health problems. So that's your deductible. And then you also have your co-insurance and co-pay. Now, this just depends on your health insurance plan and how it works. So say you do meet your deductible, you still might have a copay. Now, a copay is like you pay the doctor or the emergency room like a certain amount of money. So like for me, if I go to the doctor's office, I have to pay $50. Now, this money doesn't actually go towards your deductible. It's just like paying money to go see the doctor. Your health insurance does not cover that. Now, for some plans, even after you've met your deductible, like that $1,750, you might have co-insurance, which is where you would have to pay 20% of your bill and your insurance would pay 80% of it. So even after, like if I met my $1,750 deductible and I go to the emergency room and the bill is $1,000, I would still have to pay $200 in order to, go to the emergency room, and my insurance would pay $800. Now, this is up to your out-of-pocket maximum, and this is in-network. So my in-network out-of-pocket maximum is like $3,000. So once I meet that $3,000 threshold, my insurance will cover 100% of everything. Now, you have in-network and then you have out-of-network. So if your in-network deductible, mine is $1,750. My out-of-network deductible is $3,000. My in-network out-of-pocket maximum is $6,000, or it's $3,000, sorry. And then my out-of-pocket maximum is $6,000. So that is kind of just an overview of how health insurance works for those of us who have employer-provided health insurance or those of us who go through the health insurance marketplace, so like through the Affordable Care Act. Now let's talk about the other ways that you will have health insurance in the United States of America. Okay, let's talk about Medicaid. Now, Medicaid is a very important program. It is a government run. It's like a split between the state and federal government. Now, the states can determine Medicaid requirements, and then they will provide that money to, provide health insurance for people that are poor. Now, how does it actually work? Well, it depends on what state you live in. Now, for poor states, like if you're going to spend $1 million on health insurance. I'm using small numbers to make them easier. So if a state is going to spend $1 million on Medicaid and it's a poorer state, then the federal government will match 78% of that. So if it's $1 million, it'll be $1.78 million to be spent on Medicaid. If it's a wealthier state, it'll be like 50%. It just depends on where you live, and certain states are much more restrictive on Medicaid requirements. So the way that it basically works in most states is like, you would think that for a government-run program, you go to the doctor and then the doctor sends a bill to, the state, and then the state pays for it. Well, that's not actually how it works, right? Because here in the United States of America, we love the public-private partnership. So most Medicaid programs are ran by private for-profit companies because, everything has to make money at the end of the day because, it's the United States. So this is called the managed care model. Now, for Medicaid, like a state will pay a private insurance company like $400 a month to provide health insurance for people on Medicaid. And then if the person is healthy, then the insurance company gets to pocket that money. If the person actually needs health care, then, the health insurance company will take a loss, God forbid. We'll talk more about Medicaid here later, but that is kind of how Medicaid works. So if you are, poorer, and I mean like the income requirements for qualifying for Medicaid are insane. Like for one person to qualify for Medicaid, they have to make under $15,650. That is for one person. Now, they expanded it a little bit during COVID. They expanded the income requirements to $21,600. I don't need to tell you how catastrophically little money that is in the United States of America when your average apartment rent, at least where I live, is guaranteed like $1,300 a month. That is insane. So, that was expanded during COVID, and there's talks of rolling that back, but that is how Medicaid works. You have to make basically no money, $15,650 to $21,600. Now, I want to touch on with Medicaid expansion that they did during COVID, which expanded the income requirements to that $21,600. The state only has to pay 10% of that money, and then the federal government will match it 90% of that money. So that is how Medicaid works. Okay, let's talk about the big one, which is Medicare. Okay, so Medicare is the social safety net that you get if you're above the age of 65. So if you have turned 65, congratulations, you made it. You get health insurance provided by the government, except it fucking sucks. Like, you would think that this wouldn't have deductible, it wouldn't have co-insurance. Well, wrong. It does. It's insane. So Medicare is paid for. Well, I mean, Medicare has different A, B, C, D. We'll get into that. But it's Medicare Part A, which is like you going to the hospital and getting it covered. That is paid through payroll taxes that are split between you and your employer. So it's 1.45% on every employer taxed. That is how that's how that Medicare Part A gets paid for. Now, Medicare Part A, it covers things like inpatient hospital visits. It covers hospice. It covers skilled nursing facilities, things that older people need. Then there's Medicare Part A does have a deductible. It doesn't have any premiums that you have to pay, but it does have a deductible. It's about $1,700 a year. And then we have Medicare Part B. Now, Medicare Part B, it is covered mainly through, or it's paid mainly through federal income taxes. So Medicare Part B does have a premium. It's $185. And if you're on Social Security, well, guess what? That premium money comes out of your Social Security, which is insane. And then it also has that 20% co-insurance that I was talking about. So if you go to the doctor and it costs, they order a bunch of lab, CT, whatever, and it costs $1,000, well, congratulations, you on a fixed income, even though you pay $185 a month out of your Social Security, you have to pay $800. That's insane. Then there's Medicare Part C. This is the evil one. Medicare Part C is kind of like how Medicaid is managed. It is a private alternative to Medicare, and it sucks. Like, sometimes you'll get lower monthly premiums, but it's harder to use. And then the benefits that they tout for Medicare Part C, or it's called Medicare Advantage, you might get like a gym membership out of it, but they cover less things, and you oftentimes need prior authorization. So like if you're diabetic and you need insulin, you might have to have a doctor talk to the insurance company, and that doctor has to justify why you as a diabetic need insulin. And guess what? I mean, like people above 65, they have more health problems. That is just how human bodies work. So that is Medicare Part C. It's managed by private for-profit companies that will take money from the federal government and cover less stuff. And then they tout it as an advantage because you might get something out of it, like a gym membership. So that's Medicare Part C. And then we have Medicare Part D, which covers prescription drugs. This is also mainly funded through income tax, or the federal income tax. Now, Medicare Part D, it covers prescription drugs, and it doesn't cover all of them. In fact, the out-of-pocket costs have just been recently changed and capped at $2,000 because Medicare is not allowed to negotiate prices with drug companies for some fucking reason. It's insane. So as an older person, you qualify for Medicare at above age 65, or if you're less than age 65, you will qualify for Medicare if you've been on disability for 24 months, or if you have end-stage renal disease or ALS. Those are the only three other things that you can qualify for Medicare for. Otherwise, you have to wait until you're 65, and that is paid for. Medicare Part A, which is a hospital, it's covered by 1.45% tax out of employee payroll. And then you have Medicare Part B, which is covered mainly through federal income tax. And then you have Medicare Part C, which is the evil Medicare Advantage plan, which is managed by a private company that will literally cover nothing and tout that you might get a gym membership out of it, which is fucking awesome when you're, older and you need a knee replacement, and then they won't cover it because, you should have been using your gym membership to take care of your arthritis. It's just insane. And then you have Medicare Part D, which is mainly covered through income tax, and that is coverage for prescription drugs. That is Medicare. Now let's talk about how hospitals actually make money. Okay, so we talked about the 4 different kinds of health insurance that are common in the United States of America. Now, let's talk about how the hospitals get paid, because ultimately hospitals are businesses and they do have to make money. So most hospitals are dependent on Medicare and Medicaid reimbursements, and that's how I get paid. That's how doctors get paid. That's how we pay for things. But the problem with Medicare and Medicaid reimbursement is they don't actually pay the amount to cover anything. So if a procedure costs, like just using small numbers, if a procedure costs $100, Medicaid will usually pay about $82 of that. And then the rest has to be made up another way. And we'll get into that. But Medicare also has the same problem. It'll pay, like I said, if a procedure is $100, Medicare will pay about $90. So that is how Medicare and Medicaid reimbursement works. Now, the other way, and this is why health insurance costs are so fucking insane, is because Medicare and Medicaid don't pay enough for hospitals to actually pay their bills and they lose money. We have to raise the costs on private insurance companies and commercial insurance companies. So like if a procedure costs $100, this is why the in-network and out-of-network things are so important. So if a hospital system, they're losing money on the Medicaid and Medicare, and they get together with like a private health insurance company like Blue Cross, United Healthcare, Aetna, whatever, they will set rates of what they will pay for certain things. So, again, using the $100 procedure in fantasy land, a private insurance company might pay $225 for a $100 procedure so that they can make up the money that they lost on the Medicare and Medicaid. This is called cost shifting, and it's very common, and it's why, even though you have health insurance through a private company, through your employer, through the health insurance marketplace, this is why when you get a bill, it might be like $20,000. Your insurance did cover all of that, and you might be responsible for like $500 or whatever your deductible is. That is why that number is so absurdly large. It's because hospitals lose money on Medicare and Medicaid patients. But guess what? There's a fucking huge problem, is that poor people get sick way more often. And when they do get sick, they're often more higher acuity because they don't go to the doctor, because they already, even though they have Medicaid, they can't afford the potential for a bill, because they still might have co-insurance or whatever, or the insurance company might for some reason be like, oh well, you didn't need this procedure done, and then Medicare has the same problem. So that is how cost shifting works, and that is why hospitals actually lose money on Medicare, which is older people. And guess what? Older people get sick a lot more often. And Medicaid, which is poorer people, and poorer people are statistically more likely to get sick than the average Joe. This is why hospitals lose money, and this is why I am going to talk about how catastrophic this last year has been for hospitals, the health insurance industry in general, and for you, everyone. Okay, let's talk about like everything that has been going on this year that has made my job significantly harder. This is going to be me crashing out a little bit, so I apologize. But let's talk about first the One Big Beautiful Bill Act. So what did the One Big Beautiful Bill Act do? Okay, well, it cut anywhere an estimated $840 billion to $1 trillion from Medicaid over the next 10 years. Why is this bad? Well, I'll get into that. So it didn't directly kill Medicaid, but it did basically effectively neuter any way of states paying for it. So I didn't mention it earlier, but basically the state will pay for Medicaid programs through taxes. And one of those is called the provider tax. So the state will tax hospitals, and then in return, they get money from Medicaid. The One Big Beautiful Bill Act basically capped this, and it made new ones illegal, which is fucking awesome. So basically, states are not going to be able to pay for Medicaid anymore. The other thing that it did was when they did the Medicaid expansion during COVID, which I talked about, the federal government will pay, basically like 90%. Well, that's not a thing anymore. So that's fucking cool. The other thing that it did was it added work requirements for all adult Medicaid recipients within the expansion group from COVID, proving that they work at least 80 hours a month. I have my own opinions on that. I just think it's fucking insane. There's a lot of reasons why people can't work. Whatever. So this is alongside, there's already been about 25 million people kicked off Medicaid this year, and that number is going to grow. So the other thing that the One Big Beautiful Bill Act did is if you were kicked off of Medicaid for one reason or the other, maybe your income went up, and then, you got a new job and then you lost it. The window to reapply for Medicaid used to be 3 months. Now it's 1. So in that 1 month, if you get hospitalized and you are kicked off Medicaid and you're now hospitalized for a month, which does happen often, all the time, you're fucked. You're just gonna become homeless, and great, which is awesome because we already treat our homeless people so great in the United States of America. So that is what the One Big Beautiful Bill Act did to Medicaid. It essentially fucked it. So now, like I said, hospitals already lose money on Medicaid. And now there are places in the country where like smaller rural hospitals are very much dependent on Medicaid and Medicare, and those hospitals are now closing because they don't make any money, and the government is not giving them any more money. That's cool. So you'll have rural hospitals, critical access hospitals, especially like OB units in smaller rural communities. They're closing because they don't make any money. And that is just fucking incredible. The other thing that's going on right now is the ACA subsidy cuts, which I will get into. Okay, so if you don't remember, the government was shut down through the entirety of October. And the reason why it was shut down is because Republicans wanted to let the ACA, or the Affordable Care Act, subsidies expire. Now, what is the Affordable Care Act subsidies? Basically, it is the government providing a bucket of cash to people to help pay for health insurance. Now, like I said, if you don't have employer health insurance, and you don't have Medicaid and you don't have Medicare, well, you probably have health insurance through the marketplace. Now, like I said, like the amount of money for qualifying for Medicaid is like $20,000, which is basically $0 in America right now. So what the subsidies do, okay, so if you make less than 150% of the poverty line, these subsidies will cover the entirety of the like medium grade healthcare plans provided by the Affordable Care Act. So like the silver plans. So if you are in that area where you're making more than 138% of the federal poverty line to 150%, these subsidies will pay for you to get health insurance off the marketplace. Now, if these expire, it'll probably be like you'll have to pay like 2% of your income. So maybe like $30 to $50 a month. And if you're poor, like $30 is a lot of money because we're literally talking between like $20,000 and $25,000 here. Like we're not talking about like a lot of fucking money. So the other so the ACA subsidies, that's for less than 150% of the poverty line. Now, if you make between 150 and 400% of the poverty line, which is, like $25,000 to like $60,000, what the current ACA subsidies do is they make it to where you only have to pay between 0 to 8.5% of your income, just depending on how much money you make. So for let's just round it up to 10%. So if you're a single individual and you make $60,000 a year, you will have to pay up to $6,000 a year in premiums already. And, that's like what, $500 a month? Like, what are we fucking doing here, man? Like, that's insane. So if these subsidies expire, they'll their monthly premiums will obviously go up, and God knows, we don't know how much those are actually going to cost. So that is for middle income people, like most of you, I would assume. I don't know. I don't really know who's watching my channel, to be honest. So they also are going to get rid of subsidies for people greater than 400% of the poverty line. Now, this is more than $60,000. So right now, your premiums, like I said, are basically capped at 8.5% of your income. So, let's just round it up to 10 because I am not good at math. So you're already paying like $500 a month. So when these subsidies expire, because they literally just voted yesterday to let them expire, your premiums could increase from like insane. They're already capped at 8.5%. Now we're talking like tripling in premiums. And these are the people that, I'm most personally worried about, because in the grand scheme of things, like $60,000 is not a lot of money. If you're already spending like $500 on insurance and they triple and you're spending $3,000 a month on insurance, that's $36,000. Like, what is going to happen is people are just going to not have health insurance anymore because the level 1 plans, like the deductible's already like $10,000 fucking dollars, and you don't really get anything for it anyway. So if people can't actually just afford health insurance because these subsidies expire, they're just not going to have health insurance. Now, what does this do for me and like me being already burnt out? Well, if people don't have health insurance, it doesn't mean that they don't go to get healthcare. It just means that they don't go to their regular doctor. So like if a 60-year-old who doesn't qualify for Medicare yet sees a tripling in their premiums up to like $3,000 a month, that person's just not going to get health insurance. And a 60-year-old might have a lot of chronic health conditions that they need managed, but they can't afford them now that the subsidies expire. So they just don't get those health conditions managed. Now, that doesn't mean that people don't get sick, but it means when they do get sick, they're way more sick, right? It's kind of like an oil change, right? Like if you are driving your car and you need to get an oil change and you can afford to get your oil changed, your car will last longer. But now if you're an oil change is, $3,000 to pay for, you're just not going to get it changed. And then you're just going to hope and pray that nothing bad happens. Now your car might just catastrophically fucking explode one day because you weren't getting your oil changed. That is kind of like what's going to happen. And that's not mentioning the fact that with these reductions in health insurance and people not going on health insurance because they can't afford it, if they do go to the hospital has to eat that cost because that person obviously can't pay for their treatment. We have the EMTALA, which is the Emergency Medical Treatment and Leave Act. So emergency rooms obviously can't just be like, oh, fuck you, you don't have insurance. So this is what's going to happen when the ACA subsidies expire. It doesn't mean that people aren't going to go to the hospital. It just means that when they do go to the hospital, they are going to get sicker. When people are sicker, that impacts me. It impacts doctors because, you're going to see a lot more people die as a consequence of our government just not giving a shit about people. I mean, that's honestly what it boils down to. You kind of come to the realization that you're living in a system that just doesn't fucking care about you or whether you live or die. Like, I feel like, the government should at least provide, for the general welfare of the body politic. And if it's not doing that, you just have to come to the conclusion that, wow, it doesn't really matter if I live or die. And that's just the view of like an ordinary person. That's not like the view of someone that actually has to endure the consequences and, have the emotional burnout of seeing more people die as a consequence of not being able to, or people not being able to afford insurance. The government debt is fucking insane and it's out of control. But the way that we pay for, debt and social programs in this country is through taxes. And we consistently cut taxes and we consistently raise the debt ceiling. How can we cut taxes and, not pay for things that are going to benefit people in the long run, right? Like that's fucking insane. So hospitals are going to have to eat the cost and they're already running in the red. So what do we do about it? Like, I don't have a good answer. I don't have a plan to fix the healthcare. I mean, I know what I would like to do. It might sound controversial, but maybe doing what every other like first world nation does and having, some kind of socialized government program that pays for people to go to the doctor. It costs $3 trillion over 10 years, and we already spend about $350 billion a year on insurance. So if you multiply that by 10, that's $3.5 trillion. So we're already basically spending the amount of money that it would cost, and we already have worse outcomes healthcare wise compared to other first world nations with a socialized medicine program. So let's get into the other things that I want to talk about and crash out a little bit. So I know I touched on this, but I really want to get this through your head. And for my Gen Z viewers, that's why I have this on in the background, because I know you can't focus. So focus for just a sec. I want to talk to you about the impact of the Medicaid cuts and the ACA subsidies expiring. So the American Hospital Association estimated that in 2026, they will lose $32 billion in revenue. That is just that's just from the Medicaid and ACA subsidies. They're also bracing for a $7.7 billion increase in uncompensated care, which is people that don't have insurance because they can't afford it. And they're also probably going to lose those commercial insurance patients that they're dependent on, because remember, the marketplace insurance plans are through those private companies that, the hospitals actually make money from. So for states like the one that I grew up in Idaho, Medicaid cuts, there's a lot of rural areas that are very impoverished. So with Medicaid being cut, rural hospitals especially are going to start closing. And those have second and third order effects, especially in smaller rural communities where oftentimes hospitals are the largest employer. And so the economic impact from having a rural hospital close is fucking devastating for a lot of communities. And that's just with Medicaid expiring. That's already been happening. That's not mentioning the ACA subsidies. That's insane. So, like I said, the economic impact of health insurance imploding on itself is basically unmeasurable. It's just going to be bad. And that also kind of ties back into what I've been mentioning. Like, if a patient needs to see a doctor because they have like an infection and in their leg, like maybe they got like a mosquito bite, it became infected, they got like diabetes or whatever, they can go to the doctor, and what would cost like that, $150 to $200 when you had health insurance, you can't afford to go to the doctor now, and you don't have a doctor because you don't have health insurance. Now what's going to happen is people are going to wait until they can't wait anymore, and now they become septic and they go to the emergency room and they're like, oh shit, like this person needs to be admitted to the ICU, and then because they have diabetes and their leg gets super infected, and then they need an amputation, and then after you get your leg chopped off, you need physical therapy, or you might need outpatient rehab. So that like thing that might have cost like a couple $100s is now costing everyone millions of dollars, because ultimately that person is never going to make up for that cost, and they shouldn't. Like, that's fucking insane. So now that person owes the hospital millions of dollars, but they're never going to get paid that. So the hospital has to eat that cost, and they're going to eat that cost through laying off staff. They're going to shut down hospitals. That's, hospitals do have to make money. That's just the unfortunate reality of the way that health insurance in this country works. Okay, now let's talk about the actual plan that they have, or concept of a plan, if you will, to replace the ACA subsidies that they just repealed. Right. Okay. Now. This is from this fucking guy right here, this asshole. This is Rick Scott. He is a senator from Florida. He's a Republican senator from Florida, and I shit you the fuck not, he used to be the CEO of HCA. And if you don't know what HCA is, it is the shittiest private hospital corporation in the United States of America. And while he was CEO, he literally was convicted of the largest Medicare fraud in U.S. history. So this fucking guy really knows how to run a healthcare plan. I shit you the fuck not. This is from his website. So their plan is to repeal the ACA subsidies and replace them with Trump Health Freedom accounts. Jesus fucking Christ, I'm living in the upside down. So this is like an HCA. Or HSA, I'm sorry, not the other shitty private hospital. This is the other shitty private thing that Rick Scott wants to do. Now, what this is going to do is this is offering more options for healthcare plans and allowing other people to shop for healthcare plans, increasing competition. Now, what this is also going to do is it is going to increase price transparency. Now, I really fucking hate the idea of like the private market getting involved in health insurance, because like the market does work for certain things, right? Like, if I want to go to the store, I want Doritos, but instead of Doritos, there's also Ruffles, right? Like, there's Lay's, like I have options. So like supply and demand, they actually do matter in like when we're talking about potato chips. But like if I walk outside and I get hit by a fucking bus, it doesn't matter. Like, does the idea of having a healthcare price menu, his words, not mine, does that really help me in the moment where I'm laying on the street and there's an ambulance coming to pick me up, and I know that ambulance ride to the hospital is going to cost like $2,000, and I'm going to go to the emergency room, and that's going to cost like $6,000, and I'm going to need surgery, and that's going to cost like $30,000. Do you see where I'm going here? And these Trump Health Freedom accounts, the amount of them, or the amount in them that they're thinking about providing, it's literally like $1,000 fucking dollars for people 18 to 49 and $1,500 for adults 50 to 64. Now, when I said earlier, and I went to the doctor for a routine checkup and a set of labs, and it was $700, well, I would only have $300 left to spend. That is fucking insane. That's stupid. It's so stupid. And like I said, he was convicted of the largest Medicare fraud in history, and this is like the leading plan to replace the HCA. Now, I have my problems with Democrats too, but like, if we're on a sinking ship, and that sinking ship has a massive gaping hole in the side that has been held together by duct tape in the form of Obamacare or the Affordable Care Act, and the Democrats' idea of fixing healthcare is to put more duct tape on it. That's not the ideal situation, right? Like, I don't want to be on a sinking ship that's being held together with duct tape. Like, it's not ideal. But the Republicans' plan is like taking a fucking Stinger missile and shooting it directly into the side of the boat and being like, well, if it, that was our idea. Like, it's just stupid. It's so fucking stupid, man. Like, I don't know what the proper solution is. I'm not educated enough. I just know that it's things like this like systemic pressure coming down from the top that means that hospitals are cutting staff and nursing staff, and they're paying us less money because they can't afford to pay us more money. That is insane. It's very demoralizing working in the United States in healthcare, because you have this consistent pressure from the top that is basically shitting on you the entire time. It's fucking ridiculous, man. Like, we have to do better. Like, I don't know how we can do better. I just know that we have to do better. I'm not saying that healthcare isn't complicated. It's very complicated. We in the United States, we are lucky to have a lot of specialists compared to other countries, but other countries also, they rely on a different model, and that's also why their healthcare outcomes are better. Yes, they do have socialized medicine, and yes, wait times for specialists are lower, but they also rely more on primary care as well. And that is why their health outcomes are generally better than in the United States, because yes, I might be able to go get or see a specialist faster, but that doesn't really matter in the grand scheme of things if I just need someone to manage, blood pressure meds. I don't need to see a specialist for that. What is happening in the United States is the healthcare system has been imploding for the last, as long as I've been in it. COVID definitely accelerated it, but now it is like just being lit on fire, and Republicans are throwing gasoline on it. I don't know what the proper answer is. I just know that the talking points against, a nationalized healthcare system, they don't land, when we're talking about wait times and stuff like that. Well, it doesn't matter, because wait times in hospitals, especially in the emergency room, they're already really fucking bad. If you go to the emergency room and you're not actively dying, you might be waiting there for 10 hours. And that's only going to get worse, because people are going to rely more and more and more and more on the emergency room because they don't have health insurance. That's fucking insane. And we are the wealthiest country on the planet, and we can fix this. We just choose not to. So that's really all I got for you. I don't want to be like a doomer and talk about bad shit. I'm just burnt out. I'm tired. I'm really, really, really tired. And I know that other people are tired. I'm lucky in the sense that I have a job right now and I have a stable income, but my job is getting harder. It's getting harder because there's pressure from different angles, and it's not getting better. It's getting worse. And for the last year, it's gotten worse and worse and worse and worse. So yes, I'm sorry if this was political, and if this offended you, well, I don't really care, because they say that perception is reality. I heard that all the time when I was in the military. Perception is reality. And right now, the way that I'm perceiving things is that we are being ruled by a bunch of rich assholes who don't care about us. They don't care about you. They don't care about your family. They don't care about your neighbors. They don't care about, your hopes and dreams and aspirations. They care about buying a yacht and making their stock price go up. They care about doing stock buybacks, and they care about getting their taxes cut. Well, you and your family struggle to make ends meet. Every year you see your rent go up. You see your health insurance premiums go up. You're making less money because of inflation. You might not be able to find a job right now despite being educated, and that's not normal. And if that's you, I'm sorry. Like I said, I'm very lucky in the fact that I just have a job right now. I wanted to talk about this with all of you 10 people watching me, because if you're watching a lot of my videos, then you're probably either going into healthcare or you're already in healthcare, and you see what's going on. You might not think about it. You might not think about the consequences or the causes, but you do see, the very real harms that are being done. And it's not just in healthcare, it's in everything, right? But healthcare is a big problem for many people. It's unaffordable, it's inaccessible, and we can do better. We just choose not to because we keep electing politicians that don't care. They only want to care about, cutting taxes for their rich buddies and, taking bribes and doing crypto rug pulls and bombing Venezuela. I don't know. I don't know what the right answer is. I just know that we can do better and we have to, because I know that for me, I don't know if this is going to get better in my lifetime. I hope that someday it will get better. And I mean, this isn't just for me. Like I said, I have a good job. I have good health insurance, but this is for the people that don't. You do have to think about your neighbors or the people that you see in the grocery store, people that you go to church with, if that's your thing, people you see at the gym, because like this affects them. And you might be fine. You might be. But other people are really, really struggling with a lot of different things right now. And if you think about them, despite you doing fine, and you realize like, hey, that's my neighbor or that's my friend, it's my family member, they're not doing well. Well, this is one of the reasons why. Anyway, that's all I got. Thanks for watching.